Hi, I'm Dr. Glenn Morris. I'm the director of the Southeastern Coastal Center for Agricultural Health and Safety, and also a physician specializing in infectious diseases. The Southeastern Coastal Center for Agricultural Health and Safety is addressing a topic that's been recently on the mind of agriculture and farm workers, managers, and workers: how to protect ourselves and workers from the novel coronavirus called COVID-19. Today we'll discuss screening and testing of workers. The Centers for Disease Control and Prevention has issued guidance to protect farm owners, operators, workers, and family from COVID-19. The guidance we provide here is based on those recommendations and what is currently known about COVID-19 screening and testing. COVID-19 is a virus that is transmitted from an infected individual to another person. One of the best ways to protect workers and prevent infection is to identify those who are infected and isolate them from others while they are infectious. Agricultural work sites, and in particular shared worker housing and shared worker transportation vehicles, present unique challenges for preventing and controlling the spread of COVID-19. Consistent preparation and prevention measures can help reduce the risk of spreading COVID-19. All people should be screened for symptoms and continuously self-monitor as a strategy to protect the health of workers. The signs and symptoms of COVID-19 are diverse and can include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, which is an interesting symptom which seems to be very specifically unique for COVID-19, sore throat, congestion or runny nose, and nausea or vomiting. We would encourage you to share information with workers about the symptoms they should be monitoring. However, be aware that as many as half of all persons infected with the virus that causes COVID-19 have no symptoms, or if they do have symptoms, the symptoms may be very mild. Even in the absence of symptoms, infected people are able to transmit the virus to others. To identify people who are infected and have symptoms, screening should take place prior to entry into the work site, or if possible, before boarding shared transportation. Consider developing a policy for identifying symptomatic workers in consultation with your state and local health officials and occupational medicine professionals. In its most basic form, screening can consist of simply asking each worker as they arrive whether they have been sick or have fever or cough. If symptoms suggestive of COVID are present, the person with symptoms needs to be separated from other workers to minimize the risk that he or she will spread the infection. They also need to be tested to see if the symptoms that they have are due to the virus that causes COVID, because again, these symptoms are general enough that often you will see similar symptoms with other types of viral infections. Testing should be done if symptoms exist or if the person has been in contact with someone who is known to have COVID-19. There may also be settings in which testing of asymptomatic workers is desirable. For example, there may be concerns that infected asymptomatic workers coming from other areas or other states with high rates of disease might bring the infection with them. If this happens, these infected persons, even if they don't have symptoms, can spread the infection to family members or other members of the work team. Here in Florida, we have had at least one instance in which an entire team of over 100 H2A workers was infected when the group was joined by a worker who was infected but didn't have symptoms, resulting in serious illnesses and work stoppages. The impact on work teams becomes a particular concern when dealing with products such as strawberries, which may have a narrow window for optimal harvesting. In this setting, there may be value in testing everyone on a work team before a project starts so that infected individuals can be isolated from the group, preventing further transmission of the virus. Some states, such as Michigan, have put in place regulations regarding one-time testing of all agricultural workers and testing and quarantining of agricultural workers who move to new locations to try to minimize this risk. To learn if someone has a current infection which can be spread to other people, there are two types of tests that are used to detect the virus. One looks for the virus that causes COVID-19 in a nasal swab sample collected by a healthcare provider. To obtain this sample, a swab is inserted to the back of the nose and then put into a vial of special transport media used for transporting viral samples. The sample is sent to a laboratory for analysis. This testing may take several days, particularly if the sample has to be sent to a large commercial laboratory some distance from where the sample was collected. The second type of virus testing is what is called antigen testing. These tests are often not as reliable as the traditional swab test, but can be much quicker, with results often available in less than an hour. For rapid screening of large groups, these antigen tests are clearly the best option. At least for now, these quick antigen tests are difficult to obtain commercially. Hopefully, with time, they will become much more readily available. When an employee receives a positive test result for the viral COVID test, that means the virus was present in the sample and the person is infected. The employee can likely spread the virus to others, even though the individual may not be experiencing symptoms. At this point, the worker needs to be isolated to protect others from getting infected with the virus. A negative result on this test means that the person didn't have the virus in the sample on the day the test was done. This doesn't mean the person is immune to the virus or that the person will not get infected in the future. It is also possible to test people for the presence of antibodies against the COVID-19 virus. Antibodies are in blood. They are produced by the body when you are infected with a virus or bacteria and can help protect you against subsequent infection with that same microorganism. Tests that screen for antibodies are sometimes called a prick test because they use a small lancet to get a drop of blood from a person's finger for testing. Results from many of these tests can be obtained in less than an hour. People who are infected with the COVID-19 virus develop antibodies against the virus. However, antibodies may not appear until several days or a week or so after the infection. So these tests cannot be used to say whether someone has an acute infection or are infectious to other people. By screening for the presence of antibodies, you can generally tell if a person has been infected with the COVID-19 virus. However, we are learning that these anti-COVID antibodies may not last that long and may not be that good a predictor of whether you are immune to COVID-19. There are also problems with the accuracy of some of the assays for these antibodies. Because of this, the antibody test is not that useful clinically and does not provide clear evidence of immunity. Unless the test is run as part of an epidemiologic study, doing the test is generally not recommended. Before starting a testing program, a plan should be in place so that workers who test positive can be appropriately isolated and their contacts identified and quarantined. Local and state public health authorities can assist in the development of such plans, and employers and labor contractors should be aware of local and state regulations which may apply in these settings. Confidentiality of all workers should be maintained at all times. Testing is frequently done in drive-through or walk-up testing sites outdoors, operated by local health departments. Testing can also be obtained in hospital emergency rooms and in some health clinics and doctors' offices. If you or your employees want to get tested for COVID-19 infection, visit your state or local health department's website to obtain the latest local information on testing. Those with symptoms of COVID-19 who want to get tested should call their health care provider first. If the test is positive or negative for COVID-19, workers and staff should take preventive measures to protect themselves and others. Preventive measures including wearing a mask, physically distancing from others, washing hands often with soap and water for at least 20 seconds, and frequently cleaning and disinfecting high-touch areas. To learn when employees who have been confirmed or suspected of having 19 can return to work, visit the CDC's interim guidance for discontinuation of isolation for persons with COVID-19, not in healthcare settings, website. Additionally, you should consult an occupational health provider and state and local health officials to develop the most appropriate plan for your particular work site. This guidance to screen and test workers can help reduce the risk of spreading COVID-19 and protect workers at your work site. For additional resources for the agriculture and farming community, please visit the Southeastern Coastal Center for Agricultural Health and Safety's COVID-19 webpage and the CDC's webpage of interim guidance on COVID-19 for agricultural workers and employers.